Dr. Belinda Hernandez, who is an assistant professor at Untitled Health School of Public Health, and she's in San Antonio. She co-teaches the implementation and dissemination research course that we offer here to our doctoral students. And she is going to be talking to you about theories and frameworks for implementation science.
Okay. Thank you, Maria. Can you all see my slides? Okay, great. Thanks, Amanda. Okay, so we don't have a lot of time, but to go over this, but I'm hoping this is just going to give you a general overview of the theories, frameworks, and models, and give you an idea of the types of theories and frameworks that are out there, and what you should be thinking about when you're selecting a theory or framework. So we're not going to go into too much detail with specific theories and models that are out there. It's going to be a very broad overview. But again, it's just to give you an idea of what's out there and things to consider as you're selecting a theory or a framework or model.
Can you hear me?
Yes.
I'm sorry to interrupt you. Can the slide that we're seeing is sort of the presentation mode?
Oh, sorry. Okay, let's see. How do I switch that? Okay, let me stop share.
Or you can minimize the presentation mode one.
Oh, maybe if I do it like this. Okay. Sorry. Are you seeing?
Same slides. Thank you.
Okay, thanks. Thank you, Marie, for pointing that out. Okay, so again, I'm going to give you a broad overview and we'll go through this fairly quickly just due to time. But again, hopefully it gives you a good idea of what's out there. Okay, so I'll first talk about the importance of the frameworks and theories, and we'll talk about an inventory that's been done and how we categorize certain models. And then we'll talk about some specific, I'll show you some examples of the theories that are more common and popular right now, and then some resources for selecting and using the models. So before we get started, let's talk about the difference between theories, frameworks, and models, because people use these words very interchangeably, but they're actually really different. So theories describe a way of understanding events or behaviors. They provide descriptions of the concepts or constructs, and they explain or predict events or behaviors by spelling out the relationship between variables. So that's one of the key features of a theory. It shows you how the different constructs are related. They're not content specific, so they're more generic and abstract, and so you can apply them in different areas, in different topic areas, and even different disciplines as well. Frameworks, on the other hand, are conceptual structures or scaffolds that provide a systematic way to develop, manage, or evaluate interventions. And then a model is more of a, almost like a catch-all. That's how I use more of a catch-all. It's used to help visualize something that cannot be directly observed. It shows you the application of the constructs to your particular research question. So while they're conceptually different, both theories and frameworks can be used to enhance your D&I research. Now, there are many benefits for using theories and models if you haven't used one before. They provide a systematic structure for the development, management, and evaluation of your efforts. They can enhance the effectiveness of interventions or even implementation strategies if you're using those to develop implementation strategies using a theory or having a theory or a model as the underlying concepts of that. It's a building block for your strategies. Is really important. They ensure that you're including all the essential D&I strategies. They link your aims and your research designs and your measures and your analytic strategies. So linking it all together, which is really important. And they provide an opportunity to advance the theories in the field. So a lot of these, they're very dynamic. Some of them are understudied, you know, so if you use a particular model, there may be an opportunity there for you to move it forward and contribute to the literature and kind of the different constructs, the different measurements for these constructs. So there could be some opportunity there. And then there's source of innovation. So you can use models from outside of health, for example, for maybe a marketing, right? Social marketing, you can use that and apply that here in your work as well. However, there are some caveats to using the model for D&I. So one is that there's no comprehensive model to sufficiently appropriate for every study or program. You know, some studies, programs very complex, and you may find that you may have to use more than one model to help guide your work. Because there's no one model that's very comprehensive and that's going to cover everything. Oftentimes you do have to use more than one model. Not all models are well operationalized. And again, like I mentioned, models should be considered dynamic. Okay, so it can be changing. You know, as some developers are adding, as we're finding and learning more about certain constructs and certain factors that may be an important role, they may be adding to the model, for example. So again, you know, you should consider them as being very dynamic. So now we'll talk a little bit about an inventory that was done. Rachel Tabak and her colleagues, what they did was a systematic review of all the models, frameworks that are out there to see. And what they ended up doing is identifying 61 models out there that were published in the literature. That was done in 2012. So there are quite a bit of models that are out there. So I would encourage you not to develop your own theory or your own model, but use what's out there because there's quite a number of them. What Dr. Tabak did and her colleagues did, based on those models that were out there, she categorized these and categorized them based on the construct flexibility. So if they're broad constructs, meaning they're loosely outlined and they're not as defined. And so it allows you to have some more greater flexibility on how you're going to apply those constructs. And then there were some that were really, really defined, you know, so they're give you like step-by-step actions for the D&I research. She also categorized models based on if they were focused on dissemination or implementation or both. So you may be considering your research and what you plan on doing work in, and you know, are you focused more on the dissemination side or are you focused more on the implementation side? And there may be some specific models that you could use based on that. And then she also categorized the model based on where they were along the socioecological framework. So where they focus at the individual level, organizational level, community, or system level. So this is a really great resource if you're trying to find a model and kind of figuring out, you know, where you want to focus on here, the different levels, or, you know, how you plan on applying it. So this is a really good resource. But later, Nielsen thought of another way too to categorize these models, because we know we have so many. So we think, okay, how do we categorize and make sense of all these models, going beyond what Dr. Tabak did in her work. And what he did essentially was create these buckets essentially. So, and there's about 3 buckets here. And so when you're thinking about models, there's process models, and those are models that describe or guide the process of translating research into practice. So if that's something that you're interested in, you know, we have models like that, so such as the interactive systems frameworks and the getting to outcomes. Then another bucket is theories, classical theories, where if you're interested in understanding or explaining what influences implementation outcomes. And they're kind of these sub buckets within that. So they're determinant frameworks, classic theories, and then implementation theories. And what you see down here are just examples of those, which I'll show you here in a little bit. And then there's models or frameworks that are involved in evaluating. So if you're interested in evaluating your work, we have models that are specifically focused on that. So thinking of those three buckets, you have the process, the theories, and then evaluating. Recently, Dr. Jan Schroeder also thought of another framework too for thinking about the different theories and models that are out there, kind of loosely based on the CFR and Enola Proctor's model here. But so if you were interested in the evidence-based innovation or implementation outcomes, some of the models that you might be looking at are more of those determinant frameworks. So those, you know, again, these determinant frameworks name and define the conceptual constructs that may influence the implementation outcomes. But if you're interested more in the implementation approach and how you plan to implement the innovation, then you may look at process frameworks. So those guide the process of implementing or identifying those mechanisms of change. And then if you're interested more in the implementation outcomes or the clinical outcomes, then you would use those evaluation frameworks. And all taking into consideration the individuals involved and then the inner and outer setting, which is part of the CFR, which we'll talk about here. Okay, so again, this is going to be a lot of information. So we're just trying to give you ideas and ways to think about the models and how you would select a model. And this is another way of thinking about it by Dr. Lanefall, is thinking about where you are in the process of your project. If you're exploring, planning, executing, thinking about implementation, the processing, or the sharing. Okay, and this is how I'll show you some examples. So if you're in the exploration phase means in this phase, you're choosing a topic, you're doing a literature review, you're developing a research question. An example of one type of model that you may use in this phase is Enola Proctor's conceptual model. This was one of the first models that was published in the D&I literature, and it was really showing that in implementation science that there's different outcomes, you know, and I'm sure you talked about this yesterday, but you know, you're so used to seeing these client outcomes, looking at the satisfaction, the effectiveness as well under these service outcomes, but in implementation, you're looking more at the feasibility, the fidelity, the penetration, the acceptability, and sustainability uptake. So if you're in this exploring phase, you know, you may look at this conceptual model and try to think about, you know, what are some of your outcomes that you would be looking at within your study. Now, if you move on to the planning phase of the research, and that's where you start thinking about your study design, you're selecting outcomes, you're finding resources, thinking about grants, and you're designing some of your instruments. You know, in this case, you may want to use, you know, some of the classical theories that we have. One of the most classical theory out there is one of the most popular is the diffusion of innovation theory. And I won't go into too much detail just due to time, but basically what this theory is involved in the process of communicating innovation through certain channels. And so it's really interested in widespread behavior change, and interested in learning how new ideas, products, and behaviors become the norms at all levels of the socio-ecological model, at the individual level, at a personal, community, organizational level. With this model, the success is determined by the nature of the innovation, the communication channels, the adoption time, and the social system. And here's an illustration of the diffusion of innovations in the framework. And it's showing that the outcomes and adoption can be made, and it's based on the characteristics of the intervention, the organizational characteristics, and then the environmental context. All of these three constructs then influence the adoption and implementation of an innovation. And again, we won't go into too much detail. I have the slides here, and you'll have access to the slides. So you'll be able to kind of look at this on your own and look at it in a little bit more detail. But we'll just give a quick overview here. One of the things that I do want to point out though, because like I mentioned early on, a lot of these theories, you'll see a lot of overlap between these theories and these models, and you'll see similar constructs across. And some of those are here within the diffusion of innovations. Again, it's saying that the innovation characteristics of the innovation influence the adoption and implementation of programs. And some of the more common constructs within the innovation characteristics are like the relative advantage, the compatibility and complexity. So if someone thinks that an innovation is better than what they're currently doing, it's more, and it has more benefits than what they're currently doing, that's relative advantage. And if they think that it's better than what they're currently doing, they're more likely to implement the program, right? If they think it's compatible, if they think it's compatible to what they're currently doing, what they're currently teaching, they're more likely to implement the program. If they think it's not very complex to implement, it's not difficult, they're more likely to adopt and implement the program. So these are the various constructs, again, all related to the characteristics of innovation. And we won't go into too much detail, but I just wanted to point out some of these constructs that are common across other theories that you'll see. Again, here are different characteristics of the individuals, which would make someone more likely to adopt or implement, which we won't go into too much detail, but again, it ranges from those being innovators who are like the first in line to adopt or implement a new innovation, to laggards, those who need a little bit more help, a little bit more convincing, they're slow, so they're gonna need more outreach and incentive to adopt or implement an innovation. I'll skip that one. Here are some organizational characteristics. Again, looking at the goals, authority structure, the roles, regulations, and their types of relationships, both internally and externally. All of that, according to the diffusion of innovation, influences whether or not someone would adopt or implement the program. And then external influences, which you'll see a lot across other models as well, that there's policies, financial incentives, and then some societal level regulations as well, that may influence, again, someone's adoption and implementation. Here's another common framework that you'll hear a lot, and it's the Consolidated Framework for Implementation Research, also known as CFIR. And essentially what the CFIR is, what they did is they took, again, doing a review of all the theories and frameworks out there, and really found the most common constructs across all the theories and frameworks, and put those together. So you can think of it as a meta-theoretical model or framework here. And it's just a synthesis of existing theories, those that were the most common across a lot of the frameworks. And so we consider this a determinant framework. It helps to identify the determinants for the change, determinants for adoption and implementation. So it's a really popular framework. The thing about this framework though, it's just a determinant framework. It's not going to show you how the different constructs are related to each other. Okay, so which is different from like a theory that's showing you how they're all related. This is just showing you the different determinants that are out there. Within the CFIR, there are 5 domains. There's intervention characteristics, which we saw in the diffusion of innovation. So you can see how there's a little overlap here. The outer setting, the inner setting, characteristics of the individuals involved, and then the process of implementation. And so through the CFIR framework, you can see though that also identifying the core components of an intervention or innovation is really important here in adapting it. So as you see here, an innovation or intervention that's not adapted, you're going to have poor fits. But as you move to the right, as you adapt it and while keeping the core components intact, you'll see a better fit within the organization. So that's a key concept that's important in the CFIR, is identifying those core components and adapting it so that it can fit within these 5 domains within the organization. And this just shows you the different constructs that are within these different 5 domains. Again, you have characteristics of the intervention, like what we saw in the diffusion of innovations, and you can see that the constructs are very similar. You have the intervention source, the evidence, the strength and quality. Is the innovation, has it been proven to be effective before? If it has, that could be a determinant for adoption and implementation. The relative advantage, adaptability, trialability, complexity, which we saw in the diffusion of innovation, design, quality, and packaging, and the cost. So all of these may influence whether or not someone would adopt or implement a program. Within the inner setting, here are some constructs related to that. So you're thinking about the structural characteristics, thinking about the age, maturity, and the size of the organization that's going to adopt the program. The networks and communication, how they communicate within the organization, both informally and formally, culture, the implementation climate, and the readiness for implementation, which is also a very important construct that you'll see also in other theories and models as well. So whether or not an organization has the capacity to implement the program, basically. The other domain is the outer setting. So within this, the constructs are the patient needs and resources. Are those being addressed? The cosmopolitanism is the degree to which an organization is networked with other external organizations. Peer pressure, are they feeling pressure from other organizations to implement, or even within the organization to implement? And then external policies and incentives. The next domain is characteristics of the individuals within the CFIR. So things that you would consider here within the individuals is their knowledge and beliefs about the intervention, their self-efficacy, their confidence to implement the intervention, the individual stage of change, their identification with the organization. So how they perceive the organization and the relationship and commitment within that organization, and just other personal attributes as well. So these are all individual characteristics that you would think about, and all of that might influence whether or not someone would adopt or implement a program. And then the last domain is the process of implementation. So thinking about how the planning, the engaging, how engaged the stakeholders were, how engaged the target population was during the adoption and implementation of an innovation, the executing, reflecting, evaluating. So those are things that you would think of all related to the process of implementing a program and whether or not that may influence the adoption and implementation. So the CFIR has an online resource website, really good resource. I would encourage you to look at that on your own time. It's thecfirguide.org. They have a lot of information on the different constructs within those 5 domains. They even have some tools and resources for you if you're thinking about using some of these constructs. Like they have an interview guide that you can build if you are doing work in this area and want to do some qualitative work on figuring out some of these domain or determinants and if they're important to you. And you can go on there and actually build an interview. They have some sample questions and based on with these constructs and these 5 domains. So it's a really good resource. I would encourage you to look at that when you have time. So moving on to now the executing phase. So now you're in a different phase. Now you moved on from the planning, now you're into executing. And during this phase, you'd be looking, collecting data, carrying out the implementation strategies. Here's just one framework that might help you during this process, and that's the EPIS framework. And in this framework, it's broken up into different phases. So the exploration, adoption, active, implementation and sustainment. And so it's showing you the different constructs, different determinants that very similar to the CFR, you have different determinants that may be involved within each phase. And you see also the different contexts as well that you may consider. So this is just another model that may be helpful for you. The interactive systems framework as well is a good model too. This was developed by Abe Wandersman back in 2008, and it was originally developed to help in the prevention of child maltreatment. But since then, it's been used in a variety of settings, from cancer prevention to pregnancy prevention, drug use, all of that. It's been applied in various different health topics and areas. So it's also a very popular model out there and framework. And essentially what this framework shows you is that there's these, I guess, three different, domains here too. The first is involved with the synthesis and translation system. And that's translating what we know works and making it understandable to the layperson. You have the support system, and within the support system, you have their general capacity to implement an innovation. And then you have innovation specific capacity. So very specific to the innovation, like their knowledge and skills, or, to actually implement it. And then you have a delivery system, which also has their general capacity to deliver the innovation, and then innovation specific capacity. And all of that then leads to, adoption, these implementation outcomes. And let me see, I go through each of the different systems within the slides. I don't know if we'll have time to do that here, but again, you'll have these slides, but here's an example of the prevention, synthesis, and translation system. So the primary function of this is to distill the information generated through research about scientific innovations, and again, make them understandable for like the lay user. So it can be used by practitioners and looking at systematic reviews, meta-analysis, reviewing the literature, state of the science. And then the goal is to identify the key characteristics and core elements of programs, process, principles here. Within the prevention support system, again, you have those innovation specific capacity building and then the general capacity building. So in those innovation specific capacity building, it's related specific to the innovation. So you may be providing information about an innovation before an organization decides if it wants to adopt it. You may be providing training in how to carry out an innovation before it's implemented. Or you could be providing technical assistance once the innovation is in use. So all of that's related specifically to the innovation, and you're building their capacity to using it. Then there's the general capacity, and that's intended to enhance the infrastructure and the skills. And it's not focused specifically on an innovation, but more broadly, right? Just to help like writing bylaws or grant writing, creating those strong partnerships, or developing some of those leadership skills. So just their general capacity building of an organization. And then again, these are just different constructs when you're thinking about general capacities. And you'll see some of this, again, overlap with the CFR, overlap with the diffusion of innovations. So a lot of overlap between the different various models and frameworks. And again, I won't go too much detail here, but again, the prevention delivery system, you have the general capacity and the innovation specific capacity here. And again, just different constructs. So thinking about if they have a program champion, if they have the knowledge and skills and abilities to implement that specific innovation, looking at their organizational relationships. And again, as I mentioned earlier, that the theories and these frameworks are very dynamic. And so, and like I mentioned, sometimes we're adding things to it as we learn more. So with the interactive systems framework, originally, motivation was not included. And now, because we've learned a lot, that motivation became really important. And so at Watersman, they added this to the model of motivation. And so when you're thinking about motivation, you know, the constructs that would be involved with motivation include like relative advantage, compatibility, complexity, trialability, things that we saw in other frameworks. Here's a heuristic that that they thought of, A. Watersman and his team had thought of. It is readiness is equal motivation times general capacity times innovation specific capacity. So someone can be highly motivated to implement a program, but if they lack the general capacity or the innovation specific capacity, they're not ready according to this framework, and it won't, adoption implementation won't happen. Other hand, they can have all the capacity in the world, right? But if they're not motivated, then it's not going to happen according to this framework. So I'll pass it. So again, just another framework that can help you. And then also re-aim. So this is also a very common framework within the D&I field, and it's an evaluation framework. So if you're interested in the evaluation piece, also you could use it as a way to guide your implementation as well. But re-aim stands for reach, effectiveness, adoption, implementation, and maintenance. So it has those 5 elements. And so when you're thinking about reach, are you reaching the target population, or how do you reach the target population? The efficacy or effectiveness is what we're implementing. Is it effective? Is it working? How do I know it's working? Then there's the adoption. Are they have they adopted it? How do we support adoption? Then implementation is it being implemented with fidelity? How do we support that implementation? And then maintenance of the intervention. Is it being maintained and sustained over time? So this is a very common framework if you're interested in to help guide the evaluation efforts. Some people use it as a planning framework as well, asking these different questions, but it's more as an evaluation framework. And I'll skip over these slides since it's basically what we talked about. The re-aim also has a website. It's a really good resource where they highlight recent publications, presentations. They give you some guidance and some planning tools on here as well too. It's I encourage you to go to this website too, because they have a lot of great resources on the re-aim. Okay, and now moving from the executing phase now to the processing phase. So if you're now you're processing things, doing your data analysis, data interpretation, you can use a lot of these models, continue to use them if you use them early on in your planning phase. They should help you too in your processing of all these constructs. But if you haven't, you're focused solely on this processing. The socio-ecological model is something that's really helpful. We've used it a lot on our work and identifying, the different determinants and the constructs, factors that we've found through our research that has been shown to influence the adoption and implementation of a program, and organizing our constructs and those factors based on the level of the ecological model we find has been helpful, looking at the individual, interpersonal, organizational, community, or societal, which includes the policies as well. So this is just another framework that can help you as you're processing your data. And then the sharing phase is presenting your research findings to stakeholders, colleagues, collaborators, and publishing your findings. You want to consider what the audience knows, what they're familiar with. And some questions to consider. Again, this is just to kind of give you an overview of the different frameworks and models that are out there. Hopefully it was helpful in showing you things to consider. So some questions to think about. So what is the research question that you're seeking to answer? So that's something that might help guide you as to which model, you may select. What levels of change are you seeking to explain? What characteristics of the context are relevant to the research question? What's the time frame? Are there measures available? Some of these models have really well-defined constructs where there would be measures, others not so much. Do you need to be related? Does the study need to be related to a single model, right? Or like I said, oftentimes we'll find yourself using multiple models within a project. Are there, frameworks or models that have been used specifically for your health topic? Or are there specific implementation outcomes you want to collect that's within a certain model? So things to think about when you're thinking about, which model should I use? There's some online resources, Jake, and that's like, where do I find these models? You can look at those literature reviews that have been published that I mentioned early on. However, there's some websites. This was one by the University of Washington that kind of guides you through selecting a model. So it's a really good resource. So some of the questions to consider, and again, they present the models based on the categories, which we saw from the Nielsen, whether it's a process model, determinant, or an evaluation model. Another good resource is a dissemination-implementation.org. This also has a really great database to help you guide your work in selecting a model. You can actually go in there and select the different indicators that you may be interested in. So if you're interested, for example, individual versus community, looking at different, if you're interested in a specific construct, you can limit it here and then run the search, and it'll shoot out different models and theories that may be applicable to your work. So this is another great resource. And so basically, in summary, you need to choose a model. So because there's so many out there, it's really, really important. And so you need to choose something. Ask yourself what you're trying to accomplish. Try to work with existing models. Don't try to invent a new model. There's so many out there that you can adapt and use for your work. And then look at the many resources online. So I showed you some online, but there's also some forums, networks, all of that. Look at some of those resources. And here's some more just other resources that may be of interest to you. And you'll again have access to all of these. But that's it. So I'll take any, I don't know if we have time for questions. I didn't get to see the chat, so sorry.
Okay, go ahead, Amanda.
I was just going to say thank you, Dr. Hernandez. Unfortunately, we do not have time to take any questions, but please feel free to type any questions you have in the chat box, and we will follow up and get those questions answered about theories, frameworks, and models. And so, Dr. Hernandez, do you want to introduce our next speaker?